In general, men starting at age 50 should start getting screened for prostate cancer, which usually involves a simple blood test and a physical exam of their prostate. Now, the exception is if you had a first-degree relative, such as a father, a brother, or even a son that had prostate cancer, you should probably start getting screened a bit earlier, for example, at age 45. Men that are African American should also think about getting screened in their mid-40s. Now we're also learning that certain prostate cancers may be associated with certain genetic markers. And one of those markers is BRCA, also known as BRCA, which is more commonly associated with breast and ovarian cancer. So if you had a first-degree relative that had breast or ovarian cancer, especially at a relatively young age, then maybe you should think about getting screened a little bit earlier as well. So one important thing about PSA testing is that it can be elevated for a number of reasons. So it can be elevated due to cancer, it can be elevated due to an enlarged prostate, but other things like having a urinary tract infection, sexual activity in the last 4 to 5 days, riding a horse or going on a long bike ride can all cause elevations in PSA. So it's important to avoid those activities for about 4 to 5 days before getting your PSA checked. In general, there's two metrics that we use. One is if the PSA is above 4, then that probably deserves some further investigation, which may be a biopsy or even just getting your PSA rechecked. The other important factor is your change in PSA over time. So if your PSA is increasing year over year at a certain rate, then that may also require some investigation as well. So if your PSA is elevated and your physician determines that you need to go to the next step to investigate what's going on with your prostate cancer, that typically involves a biopsy of your prostate to determine if there's any cancerous cells within the prostate gland. Now, one specialized form of diagnosis that we can do here at the Texas Center for Proton Therapy is something called an MRI ultrasound fusion biopsy. And what that does is that we take a sophisticated image of your prostate using a 3 Tesla MRI. We map out the prostate to see if there's any suspicious lesions within the prostate. And those images are then fused with an ultrasound image in real time, and therefore not only can other parts of the prostate be sampled, but those suspicious areas can be sampled with a little bit more fidelity. And studies have shown that the pickup rate of detecting prostate cancers of significant grade is improved by using that MRI ultrasound fusion technique. So the success rates of proton therapy is very high if the prostate cancer is caught relatively early. However, nothing is 0%, nothing is 100%. So in general, the earlier you can catch prostate cancer and treat it with something like proton therapy, your chance of being cured could be in excess of 90 to 95%. Now, if the disease is a little bit more advanced, we can still achieve pretty high cure rates, but we may have to add other additional therapies such as hormone therapy to the proton therapy. So being diagnosed with prostate cancer may increase the risk of your first-degree relatives also developing or having prostate cancer. So it's a good idea if you have a diagnosis of prostate cancer to tell your father, your brother, and your sons to get screened for prostate cancer as well. So prostate cancer can be treated with various treatment options. If it's caught early, it can be treated with local therapy or sometimes just with active surveillance. But the local therapy options typically involve either doing some form of surgery or some form of radiation therapy. And proton therapy is a form of radiation therapy, but a very specialized technique. So unlike x-rays, it's using particles. And unlike x-rays, particles don't go all the way through your body. We can control how far they go into a patient. So once they hit the prostate, the dose doesn't keep on going throughout the other side of the body, which is what happens when you get treated with x-ray therapy. Now, because of that, we can deliver a high dose to the prostate gland, that's where the cancer is, but we can largely minimize the radiation exposure to normal tissue, such as the bladder and the rectum. We're also finding in a recent study from Stanford using the National Cancer Database, when they compared patients with different kinds of cancers, including prostate cancer, that got IMRT, which is the more conventional form of radiation, versus proton therapy, the patients being treated with proton therapy had a substantially lower incidence of developing secondary malignancies later in their life. Another advantage of proton therapy for diagnoses like prostate cancer, since we can confine the high dose to a relatively confined target and minimize the stray radiation dose elsewhere, that can minimize the side effect profile not only in the acute setting, but also months or even years later. And one thing about prostate cancer is we want patients to be cured of the cancer, but we're also very interested in preserving and maximizing their quality of life, not only during their treatment, but for many years afterward. And proton therapy affords us a tool to do that.